Hello, everyone, and welcome to Ask the Pharmacist. I'm Kelly Kraft, Program Manager at Gilda's Club Quad Cities. Just to give a little bit of background about what we do, we are a cancer support community that provides 100% free psychosocial support to anyone impacted by cancer. So that's a person with a current diagnosis, survivors, family, friends, and kids. Our programs include support groups, educational workshops like this one, healthy lifestyle activities like yoga and meditation, social events, and kids and teens programming. I'm live today with Walgreens pharmacists Tom and Stephen, and I'm going to let Stephen take it away.
Sure, so I'm gonna steal the screen here and show. So my name is Stephen Donnelly. I am the pharmacy manager at the Walgreens Specialty Pharmacy in Des Moines. Looking forward to talking today really around Ask the Pharmacist workshop. The idea here is to allow patients to understand where pharmacists can play into their care team and how we can help with the whole process, the journey of going through cancer treatment. So we'll get started here, and I will let Tom introduce himself.
Sure. Thanks, Stephen. So to echo, thanks for everyone joining tonight. And again, yes, we're just here to reach out and be another pillar for support for everyone here in the community. So my name's Tom Truong. I am the pharmacy manager at the Walgreens Specialty Pharmacy in Iowa City, serving the eastern part of Iowa and the western part of Illinois.
So my picture there. And then, we're more central Iowa out of our Des Moines location. We're on 17th and Ingersoll downtown. Give you a little bit of background on what our specialty pharmacies look like and how we differentiate. This is a picture of my store, a little bit colder when I took that picture than it was today. But
even I don't think I'm capturing your screen. Can anyone else see it?
No, we can't see your screen right now.
You can't? Okay. Let me see if I can go back one here. What are you guys showing? What slide?
Just your face.
My face. Okay, well, we need to get off of that one. Are you seeing the advance now?
Nope. No.
Okay.
Have you hit that green share screen button at the bottom of your Zoom screen?
Let me see here. Yeah. So I hit this. Let me get back in here. I'll do it. I'll reset it here.
This looks like it's
how about now? Okay, sorry about that. Technical difficulties. I've been having them all day.
These things happen, no worries.
Yeah. So this is a picture of our community site. So when we're thinking of Walgreens, we have a reputation for the 9,000 stores happy and healthy, right? And that's a reputation that we've spent over 100 years developing, trying to create a trusted environment for patients to come in and see their pharmacists. We've expanded on that by adding about 300 specialty locations around the United States, and Tom and I are managing the 2 in the state of Iowa. The idea is similar to our retail stores. We want to be able to help our patients access financial resources, access information about their medications, but within our specialty stores, we're working with medications that need a bit more attention, whether that's due to very high financial costs, side effect profiles, relationships with providers that have to be a little bit more unique. And that takes a lot of work and a lot of specialization. And so we've got a team in both of those sites that are kind of devoted to making sure that happens and seeing if we can take care of those patients in the best way possible. So to kind of kick this off and make sure that we're hitting questions, these are questions like I had mentioned earlier that we're seeing regularly. I don't want this to be a full, didactic session where we're just speaking to you. I want to make sure that you're feeling comfortable asking questions in the chat. So what we'll do is after each question, we'll pause and see if there are any questions in the chat room to make this as interactive as we possibly can virtually here.
Yeah, so Kelly, feel free to stop us if there is a question. But like Stephen said, our plan is just to stop after each of our kind of title headers here and see if anyone has any questions that may relate to this. So I guess the first general question is, what should my relationship with my pharmacist look like? So again, Stephen and I, we're considered specialty pharmacists. So what does that look like? Again, we don't have a front end of the store. We have a lobby. We ship most of our medications out directly to people's homes. So, our relationship with the patient, with you, is going to look a little bit different, because you're not typically coming into our store, since most of you will likely be miles away from our store, and everything we do is done by phone. So our sites are set up a little bit differently, where we have consistent 2 or 3 pharmacists with 3 or 4 technicians that are really there Monday through Friday to help you out, whether it is, again, with adverse effects, adherence, financial barriers, things like that. So really, what does our relationship look like? So we're there for you for any step of the journey, from your diagnosis to hopefully your final dose. So we answer any questions that you may have to help you better understand your medications. We're generally just here as a resource for you for whatever you may have to ask us.
Kind of elaborate on what Tom's saying. Whenever a pharmacist, or at least this is true for me and 99% of our pharmacists that I talk to, the entire goal here is, when entering the profession, to create those strong pharmacist-patient relationships. And when I'm working in stores that are so convenient and patients choose us, it's so easy to create those strong bonds with the patient and with the family. When we work in the specialty pharmacy space, we're trying to create those connections over the telephone, and we do our best to make sure that those connections are strong. But anything that we can have the patient do to help us create those strong relationships, the better. And so asking those questions, leaning on us, we're problem solvers. We see high copays regularly. We see these side effects. There's a good chance that we have a pretty good answer, or at least the resources to help.
Anything, Kelly, or anything from the audience?
Okay.
Not yet.
We'll go ahead and move on to the next question, and let us know if something comes up and we can swing back around.
I will.
So how bad is it if we were to skip a dose? So when we're thinking about these medications, we're really dosing them for a few different reasons. We are dosing them in a certain way to manage side effects, optimize regimen. And so taking the medication on the known schedule is so important. The key to getting the best treatment is to make sure we're not only taking it as prescribed, but we're taking it on time, and then we're understanding how to prevent ourselves from missing those doses. So when we're thinking about drug therapies, the main goal that we have here is to keep the amount of the medication steady in our body, so we're not having those peaks and troughs. When we do miss a dose, unfortunately, the medication does have that trough, and then we're reducing our effectiveness because we're not getting that therapeutic level. Really, if we if we try to catch up and we're taking them too close together, then we get the opposite. Instead of that trough level, we're going too high, and then we're increasing our risk for severe side effects. So as pharmacists, one of our main goals is to promote adherence through reaching out to the patient ahead of time, making sure those side effects are not going to be limiting, offering to send the medications out in a timely manner, and then understanding that the insurance companies and those costs can be burdensome for some of our patients, and making sure that we have time to go ahead and work through those issues.
Nothing so far.
It's okay.
Tom, do you mind if I take the next question?
Yeah, absolutely. Sorry, I think, yeah, go ahead.
Okay. So what do we do if our medication is too expensive? And this is something that we see very regularly. as pharmacists, our goal is to not only make sure that the medication is accessible physically, it's to make sure that we can access the medication financially, and we're not putting too large of a burden on the patient that they would have to go without, or making a medication that would be the preferred choice by the provider and accessible, and making sure that the financial piece is not having us choose a secondary option. Really, the way that we approach this is going to be based on the specific patient situation. So for our patients that are commercially insured, we can go directly through the manufacturer, and that might look like a copay card, a program where they're helping to pay down any type of deductible we might have along with that co-insurance piece. When we run into Medicaid in the state of Iowa, generally, if we get coverage through the prior authorization process, it's going to be a $0 copay. Our more challenging situations, and many of you might have experiences, is when we're working with our Medicare Part D programs. And that's not because Medicare Part D is any more difficult as far as getting approval. It tends to be a pretty smooth process. However, the Medicare plans restrict how we receive financial assistance. They want to make sure that providers are prescribing based on what is in our patient's best interest and not what money is available to help pay down these copays. So we work with nonprofit grants. Those grants do an excellent job of putting money towards a diagnosis, and then we can help our patients access that money for that diagnosis and pay down their copays. The challenge that I see as a specialty pharmacy when working with this is it's not readily available. Many patients are not aware that this money is available for them, and so it's such an important part of the pharmacist role to connect patients to these.
Yeah, and I think just reiterating what the relationship with the pharmacist looks like. Again, this is something that we see and do really every day to help patients. If you are faced with an $1,800 copay a month, that's not the final stay for the most part. It's something that we can look and dig and see if there's any financial programs or assistance, or I like to think of it as real dollars at work. So you think of your favorite charitable organization that you donate to, whether it's Susan Komen or LLS Society. Those dollars are redistributed to truly help you as the patient. And so you don't think of it when you go to a grocery store, when you ring up $3 and donate that money to that organization, but those organizations are the ones that are redistributing those dollars in the form of copay assistance, and that's something that we can help with. So nothing yet?
Nope, no questions.
Perfect. Just like Steven's other question about, how important is it if we miss a dose, or how important is it to stay on track for your dosing? So for this one, how can you keep track of your medication? I think with today's age, there's devices and applications and reminders all over the place. So just a few applications on your phone. There's MedSafe, My Med Schedule, My Meds, RX Mind Me, Caring Village, and the Walgreens app itself actually has a reminder also, not just to refill your prescription, but also to remind yourself to take your medication. So I think the first important thing is just to know what medications you're on. Typically, we're going to see an oncology patient have more than a handful of medications. And I myself, I know I would be a bad patient. I know that, and I'm a pharmacist, so I can totally understand the real world aspect of being a patient and physically having to take medications. So I think it's important to, one, know your medications, and then two, have a routine of those medications. So dividing those up with a pill box, and whether it's morning, afternoon, night, Monday, Wednesday, Friday. Sometimes we have medications that are dosed once every 3 weeks or once every 4 weeks. So we have monthly pill reminders, or you can have a reminder on your phone, and those are monthly, weekly, daily reminders, or even every 4 hours or every 6 hours. So again, just to reiterate the previous question that Stephen had, how important is it? It's clearly very important, and these are just a couple things that can help remedy that. So.
No questions so far.
Okay.
Remember, everyone on Zoom, if you have any questions as we're going through, feel free to comment them or to chat them in, or we will have some time at the end too.
Sounds good. So what are the common side effects that I may experience while on cancer medications, and what tips can my pharmacist provide? So I think this is so important, and this is where the bulk of the questions to the pharmacist come when I'm working with patients in the specialty pharmacy. Really, the underlying theme that I'm going to try to hit on here is how our patients can support the care team and make sure that our side effects, while they can and with a lot of our therapies probably will happen, how we can keep them so that they're not so severe that we're stopping therapy. And how we can relay that these side effects are happening to our pharmacy team or our care team with the provider's office to make sure that they're recognized right away, and we can do things like dose changes instead of, again, stopping therapy. So I've got about 5 or 6 common side effects that we do see, and a few solutions that we can use to potentially decrease these side effects or make it so they don't get more severe. Nausea and vomiting is one that we do see. The main recommendation here is just to eat frequent small meals. When we see that a couple of times working through these side effects, avoiding any food that generally will cause that nausea, vomiting, foods particularly with strong odors. And then lying down within 2 hours after eating can actually worsen symptoms of nausea and vomiting, so we'd want to avoid lying down within 2 hours after eating. Diarrhea, the main thing that we're looking here is to replace the fluids lost. Replacing the fluids with drinks that do have electrolytes. Something like a Pedialyte is fantastic. Gatorade is also fantastic. It does tend to have quite a bit of sugar in Gatorade. So when I'm working with patients, I do generally recommend maybe splitting that 50-50 with water, but an excellent choice. Over-the-counter medications that we can look to, Imodium is an anti-diarrheal medication. And of course, we do have prescription drugs available if that's not doing it for us. And then adding bulk to our stool really does a nice job at helping to decrease the symptoms of diarrhea. So looking into foods that contain fiber. Loss of appetite, we see this pretty regularly. So again, small meals throughout the day is very important. And then when eating these meals, we want to make sure that when we're eating, we're not feeling full too early. So avoiding drinking a lot of liquids and just taking small sips throughout the meal is going to make sure that we're getting that caloric intake that we need. And then focusing on medications that do have that high calorie content along with high protein snacks will just do a wonderful job at making sure that we're getting what we need out of the foods that we're eating. Managing pain. So there's a number of options when we're looking at pain relief, and it's so important. And this is something that pain relief, when working with your prescriber and their care team, is going to be a topic that comes up pretty regularly. It's kind of a balancing act, but there are over-the-counter pain relievers that we can choose, Tylenol, Motrin. What I would like to stress here is before we would try anything like that, please ask your pharmacist. That drug-drug interaction check can be so important, even when we're using over-the-counter therapies. The final side effect that we see pretty regularly is our effort to manage fatigue. With this, there are a few recommendations here, taking breaks and short naps throughout the day. Also, if we can get any type of light exercise in, if that is going to be possible, generally patients find a lot of value in that in helping to manage that fatigue. And then, of course, relying on friends and family to help us with any tasks that might be tiring or we find difficult is going to go a long way in the success of keeping these symptoms at bay.
We do have a couple of questions that came through in the chat. So this person said that their mom is in her 5th round of chemo and has a bad taste in her mouth, making food taste awful. Is there something that can help with that?
I'm not thinking anything medication specific. Obviously, with any type of chemotherapy, we talked about this in the Feel More Like You session a few weeks ago, where anything with what we call like high cellular turnover, so hair, skin, mouth, those are going to be affected, and I'm assuming that's what's affected. if there's a bitter or a metallic taste. Really, not specifically that I can think of medication related that would help with that, other than just the normal oral hygiene, ice, gum. I think Stephen mentioned in the previous slide, small frequent meals to help break that up rather than eating one big meal every 4 or 6 hours, breakfast, lunch, and dinner. But having small frequent meals may help that as well. But yeah, no, I can't think of anything specifically medication wise that would help alleviate that other than just the oral hygiene.
Yep. Yep. That's exactly what I would say. That oral hygiene, we see that metallic taste in particularly semi-regularly, and yeah, the oral hygiene tends to be the number one recommendation to see if we can decrease that side effect.
And just through stories from our members, this is something that I've heard, and just let me know if this is something that you've heard, if it's helpful or not, but sometimes using plastic silverware instead of metal silverware, is that recommended at all?
Interesting. I've not heard that, but yeah. And you've had patients say that helps.
We have, but this is just story, so I'm not sure if it's,
Sure.
We haven't done any research or anything. I was just wondering if you guys heard that, because that's just something that I've heard around.
If that works, that's wonderful, and I'll add that to my repertoire. I have not, but that would not hurt anything, that's for sure. So that would be worth a try.
And we have a couple other questions, and just because I'm adding something and I'm not a doctor or a nurse or anything, these are stories that I've heard from our members. But
Sure.
This one might be a little bit too in depth. Let me know if this is true. But this person has an ileostomy and high diarrhea output. They use, and I'm going to mess up this drug name, defenoxylate. 4 times a
Perfect.
day. They heard, okay, good. They heard if it's regularly used, it can have the opposite effect. Is that true?
For me, a lot of people have what we would call the anomaly effect of what you would think, what the opposite of what would happen if you were to take a medication. So the perfect example for us is taking Benadryl, and then it makes you extremely awake and hyperactive. So it may be something that you may have heard of, difenoxylate specifically. I don't know if that would be something that your body would grow tolerance to. This is something that you would probably take for days at a time, hopefully rather than weeks at a time, unless it's a severe case. But not something that I'm aware of. I don't know, Stephen, I don't know if you have anything to add there.
No, I don't. No, I don't have anything to add to that. That would be, yeah, I mean, I would have to look into that, because that's not what we would expect. Which I would be happy to do if you're interested in giving me a call at the pharmacy. We're open 8:30 to 5 Monday through Friday. I could do a little bit more research, and we could connect on a one-on-one basis. And I'd be happy to have a further conversation around that.
Thank you. And we have one more here so far. This person's medicine is making them dizzy. Any ideas on how to help that?
So that depends on the reason. I'm wondering if we're having dizziness in the beginning of the day. Dizziness is one of those things that we generally, it might be a bit of orthostatic hypotension. And so what's happening is when we're sitting up too quickly, we see that dizziness, almost that faint type feeling. Generally that does go away with a little bit of time. So kind of getting up more slowly. Are we able to respond? Is there a specific time that we're having dizziness, or is it just generalized?
I don't see anything in the chat yet. Oh, generalized.
Okay.
Yeah, and it could be, it could be a whole slew of things. It could be environmentally related. It could be medication related, food related. We talk about Zofran very, very often in chemo and oncology, but again, that's something that we certainly can't prescribe. It's a medication that would have to be prescribed from the provider themselves, but that's something we would typically see in really any chemo regimen, whether it's pre-treatment, before your oral chemo, and even after, just to anticipate the nausea and the dizziness. So
Yeah, that would be something that I would definitely talk to the care team. If that's happening just generalized and not periodic, we'd be looking more prescription strength therapies to help bring that side effect on.
And another person in the chat is having a similar situation, and their loved one is having that dizziness with their chemo too, and asking if there's a vertigo med that could help.
As far as over the counter, meclizine is pretty harmless in terms of drug interactions. Again, that's something that you would want to check with your care team to see if that's something that you should take. Of course, there's prescriptions just like the Zofran that we had previously talked about. But when we think about vertigo, I think the first go-to trial would be meclizine.
Sure. I agree with you, Sam. We could try the meclizine. I don't know. I don't. That would be fine, and it doesn't have too many drug interactions that we would have to worry about. So I think that would be a fine try. I'd probably instead of trying that and letting it worse, I'd probably just reach out to the provider. I think you nailed it with ondansetron to start. I think that would be the easiest thing to add. Very common in our regimens, and I think that would be a quick conversation and potentially a quick easy fix. So in that situation, instead of battling over the counter, meclizine would be the drug of choice. I'd probably go to the provider and see about something like Zofran.
And if anybody wants to get a hold of you guys at the pharmacy, is there a phone number that they should call?
Yeah, absolutely. So in Iowa City, we are 319-471-4285. And just like Stephen, we're open 8:30 to 5 Monday through Friday.
Yeah, in Des Moines, our phone number is 515-657-8896.
Stephen, could you say that again? And that's where?
So our Des Moines location, did you get the phone number, the 515-657-8896?
Perfect. I just put that in the chat. And 8:30 to 5, correct?
Yep. Perfect.
And I think that's it for questions so far.
Okay.
So just to wrap up, available resources and Gilda's Club, thank you for having us for this session and the Feel More Like You session from a few weeks ago. But of course, everyone here already knows about Gilda's Club and the support that they have for their families and their friends and their relatives. And hopefully everyone was on the session a few weeks ago with Greta with Feel More Like You and the opportunity that we have for our beauty advisors in our stores that are trained and ready to help patients who may be struggling with self-image and are just looking for a little extra help. And of course, we've already given our contact for our specialty pharmacies. And again, Stephen and I are local in Des Moines and Iowa City. Of course, there's some in Illinois as well, but we're more than happy to help. And we are, again, grateful for Gilda's Club having us tonight.
So does this seem like the time to stop that Facebook Live broadcast then?
Stephen, I think there's maybe one more. Is there one more slide, Stephen?
Oh, perfect.
Yeah. So I wanted to hit on this when we're thinking about oncology and the medications available. It's very limited on which pharmacies can receive some of these therapies. So we partner with a couple of stores, one out of our Minneapolis location and then one of our St. Louis location, where if we at the Des Moines or Iowa City location don't have access to the medication, these teams are specialized in supporting patients undergoing cancer treatment. The two clinic managers at those sites, Brian Arnold and Josh Budeman, are wealth of knowledge. They're fantastic. So I would recommend that if you have medications you're having trouble getting at one of the larger specialty pharmacies or having trouble accessing, give Tom or me a call. There's a high likelihood we'd be able to find it at either Brian or Josh's location. Otherwise, yeah, at this point, we were going to dive into question and answers, which I think we did throughout the broadcast. And if there's anything else, if there's nothing else in the chat, then yeah, we were wrapping up there.
So I will end the Facebook Live broadcast here in a moment. Just anybody who might be watching on Facebook, if you have any questions, give us a call. We're at 563-326-7504. And thanks so much for joining.